Talk about Modifier 25 and the way that we are to use it appropriately with E&M coding. Modifier 25 is used to show that you performed a separate and identifiable E&M with a diagnostic test or procedure. Many diagnostic tests or procedures are pre-planned or pre-ordered in visits prior, so that when they come for their follow-up, it is to be performed, and many times patients have problems outside of that test on the same day. If the patient is not coming to the physician just for testing only, and he does an exam, a history, sees the patient, and they have a problem outside of the scope of the procedure performed, the physician can then build that E&M with a Modifier 25 along with those diagnostic tests and or procedures. If a procedure is 0 to 10 days globally, it is appropriate to use Modifier 25 on that E&M. If it is a 90-day procedure with a global of 90 days, you would use Modifier 57, Decision for Surgery. A good example for that is, I go to the ER, I get admitted. The physician sees that I need a surgical procedure. After he examines me, he's made the decision to do surgery during that ER visit. He would attach a Modifier 57 on the E&M to show that he truly determined that decision for surgery and that treatment time. That's important to remember because many people get Modifier 57 and 25 confused. Modifier 25 is a very useful tool and should be used when necessary. The physician must document in his medical record how that exam was separate from the procedure. The chief complaint, the patient's history, review of systems, the exam, the problem they're having that's unrelated to the procedure, and document that in his plan and how he plans to treat it. That is acceptable to bill that E&M with a 25 with that procedure. Where it would not be acceptable is the week before I went to my physician, he ordered a test. He tells me to come back the next week and just go to the testing lab and have the test performed. I would go to the lab, I would not see my physician, or he may even supervise the test, but that is my only intent for the visit for that day. I would not append a Modifier 25 to that E&M if the doctor checked that on his charge master, his charge ticket. I would question it and I would pull the note. If that is all that patient came for that service only, you would not bill an E&M, and thus it would not be appropriate to attach 25. 25 is a modifier that Medicare looks at every year. For the past several years, it's been on the OIG work list, the Office of Investigator General. They track errors and erroneous claims, and they have a work plan list of the top errors that they see when Medicare pays money incorrectly. Modifier 25 is a heavily abused modifier. So, the OIG wants the RAC auditors, the Medicare auditors, the claims processing people to look at those claims a little closer. It is a great modifier, but it is to be used appropriately, and many physicians have a very hard time distinguishing the difference between supervising a test and a true exam and a true separate visit. So the more educated that you are on Modifier 25, you can help your physicians increase their reimbursement and also to bill correctly and compliantly to Medicare and other third-party carriers. Also, it is important to understand how each payer looks at Modifier 25. Some of the commercial payers, some of the third-party payers want you to use different modifiers because their policies and procedures are different. Medicare, however, is pretty much the same across the board with 25 all the time. When using modifiers, it is very important to know how each carrier uses them outside of large carriers as Medicare, Medicaid, your Blue Cross carriers in certain states. That is very important to be mindful of. Some carriers allow things that maybe Medicare wouldn't. But 25 is still an E&M only modifier, and it still should only be appended no matter what carrier the patient has in the appropriate circumstance.